Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. November is Lung Cancer Awareness Month. Unfortunately, lung cancer remains the leading cause of cancer death for both men and women. Fortunately, there have been advances in treatment and expansion of eligibility for lung cancer screenings. During today's show, we will learn more about risk factors for lung cancer, prevention strategies, and the latest treatment options. We are pleased to welcome Caitlin Ricardo, Lung Cancer Screening Program Manager at Robert Wood Johnson University Hospital Somerset and Robert Wood Johnson University Hospital Hamilton, and Dr. Benjamin Medina, a thoracic surgeon who specializes in thoracic oncology. Dr. Medina sees patients at 3 RWJBarnabas Health facilities: Robert Wood Johnson University Hospital Somerset, Robert Wood Johnson University Hospital Hamilton, and Monmouth Medical Center, as well as the Rutgers Cancer Institute of New Jersey, the state's only National Cancer Institute designate comprehensive cancer center. Welcome to the show. Welcome, both of you, to the show. So what we're first going to start with is a little introduction. Caitlin, can you tell us a little about yourself, your background, and what got you involved in the lung cancer screening program at Robert Wood Johnson University Hospital, Somerset?
Yes, good morning. Thank you for having me back again this year. My name is Caitlin Ricardo, and I'm the lung cancer screening program manager here for Robert Wood Somerset. My clinical background is in women's health. I was a medical assistant for about 12 years, and then I went back to college for my bachelor's in healthcare administration. I came over to Steeplechase, started working in oncology, and kind of coming out of COVID, our lung screening program definitely needed some attention and help. And so I jumped into that role and took over, and we started revamping and relaunching our program to the community, and we've been doing really well ever since.
Thank you. And Dr. Benjamin Medina, can you tell us a little bit about your background, where you're from, medical school, et cetera?
Sure. So I'm originally from New Jersey. I'm from Livingston in Essex County. I went to medical school at Rutgers in Newark, New Jersey Medical School. I then elected to choose a career in surgery, and so I did general surgery training at New York University in Manhattan. And then I followed that up with a fellowship in thoracic surgery at Memorial Sloan Kettering. And I joined Robert Wood Johnson directly from Sloan Kettering, where I've been practicing all aspects of thoracic surgery with a focus on thoracic surgical oncology. So that includes the lung, the chest wall, the esophagus, and the mediastinum, which is kind of the middle of your chest.
Thank you. Let's start simple. What is lung cancer? What causes lung cancer? And what can we do to reduce the risk factors of developing lung cancer?
Yeah, so the number one cause of lung cancer, as many people will probably know, is smoking and exposure to smoking. So that can include significant secondhand smoke exposure as well. You know, cigarettes contain a multitude of compounds and chemicals which can damage your DNA, or the sort of code that underlines all your cells and cellular processes in your body. And this can lead to mutations that can result in tumors. And everything really that causes lung cancer kind of exists along that spectrum. So smoking, secondhand smoke, cigar and pipe smoking is included in that. We don't know yet about vaping. It's a little bit convoluted because many people who vape also have smoked cigarettes in the past, but that is certainly something we're keeping an eye on. And then occupational exposures, including exposure to asbestos, which many people will know can cause mesothelioma, that causes a tumor in the lining of the chest wall, but also asbestos has been linked to lung cancer as well. And then I think important to people who live in Central Jersey, radon exposure is another environmental factor that can lead to lung cancer. So there are many different potential causes and risk factors.
So again, the most important thing that the audience should take away from this is stop smoking.
Correct.
And part of RWJBarnabas Health, we do have a smoke enders program. So anyone who's actually listening to this program and is thinking about that, it's a good idea to get in contact with RWJBarnabas and get into the smoke enders program. But let's go on from here. Are there signs and symptoms of lung cancer that people should be aware of?
So for early stage tumors, meaning very small lung cancers, often there are no signs, which is part of the reason we'll get into screening, why screening is so important. Once tumors get larger or spread, that's typically when patients will start to experience symptoms. This can include a chronic cough that won't go away. Maybe your cough has specks of blood in it. Maybe some shortness of breath that comes on somewhat gradually and doesn't seem to get any better. And then once tumors spread to other parts of the body, then there are other symptoms depending on where that be. So for example, seizures or headaches or neurologic disturbances with metastasis to the brain. But often early stage lung cancers, there are no symptoms.
So I'm a primary care doctor, and I also graduated from NYU, but I graduated back in 1984. And at that point, we used to do chest x-rays. Normally, as a routine part of the exam when someone came in for an annual wellness exam. And then we learned in the 1990s that by the time it showed up on a chest x-ray, it was usually too late. It was past the time that we could do anything. And that's why we're going to discuss the lung cancer screening program down the road. But one of the things as a primary care is we know initial lung cancer, most of the time, there's no symptoms whatsoever. And that's why it's important to reduce the risk factors so that the primary care doctor doesn't have to refer you to a lung cancer person for the next steps. And then we also know that if the person has a chronic cough, that's something we need to look into. That may be one of the signs or symptoms of it. We usually send them to a lung person. We send them to a pulmonologist. They do PFTs, pulmonary function tests. They do x-rays. They do further testing, and that's possibly where we'll find it. So it can be from nothing to they're coughing, they can't breathe, they're very short of breath. And it's important for the general population to know that we've got to reduce the risk factors. So what are the different types of lung cancers? I know that there's a whole spectrum, and maybe you can help the audience understand a little bit about that.
Yeah, so the most common type of lung cancer is called non-small cell lung cancer, and this has been definitively linked to cigarette smoking. Less common is a type of lung cancer called small cell lung cancer, and they differ in their behavior significantly. So non-small cell lung cancer has a good chance of cure at the early stages, and there are also very effective systemic therapies for that. Small cell lung cancer is generally very aggressive. There is a role for surgery for a minority of patients with very early stage diseases. Often we don't see small cell until it's become a little bit more advanced. And then there are other types of lung tumors that may require surgery or radiation therapy, such as carcinoid tumors, which are not linked to cigarette smoking. But when we're talking about lung cancer, really we're talking about small cell and non-small cell lung cancers.
And that's why it's important when, as a primary care physician, when I do find someone who has something like this, to refer them to someone like you who's part of the Rutgers Cancer Center, because it is the state's only National Cancer Institute designated comprehensive cancer center, so that there's a team approach to the treatment of that patient.
Yeah,
now,
so this is becoming really important. Over the past 15 to 20 years, we've learned a lot more about how these tumors form, what drives them, how they're able to proliferate in the body without being eliminated by the immune system. And so really when we're talking about treatment for lung cancer, we're talking about a group of people getting together who have expertise in a number of different fields. So that includes myself, who is a surgeon, but also a medical oncologist who prescribes chemotherapy, targeted kinase inhibitors or immunotherapies, radiation oncologists who can administer radiation, And involved in this are the pulmonologists and the pathologists who help us diagnose and stage lung cancers. So every week we all get together and discuss some of the more complicated cases, because really the treatment algorithms and the decisions that we make now have advanced significantly compared to where we were just 15 to 20 years ago.
15, 20 years ago, I would refer them to the pulmonary person. They'd go in, do a bronchoscopy, come up with a definitive diagnosis. They'd go over to the oncologist, who basically is working by themselves. Now, with the team approach, they have everything. They've got social services to help, even just getting them back and forth from the hospital. And they've got they've got the oncologist, they've got the pulmonary specialist, they've got the radiation oncologist. The team approach at the Rutgers Cancer Institute makes a very big difference to the patient.
I agree. It's super important. I mean, just being diagnosed with lung cancer, or any type of cancer for that matter, can be extremely overwhelming, and all of a sudden there's tests, there's a lot of people to see. What's great about the system that we have set up is there are coordinators who can help patients through that process, and every step of the way there's a physician who's advocating for the patient, and we're all in direct communication with one another. So I think from a quality standpoint, we're offering a complete service from diagnosis to treatment of this disease.
Diagnosis, treatment, and aftercare, and done at a local place where people don't have to travel 3 hours back and forth, having to think about getting transportation back and forth, and having people such as Caitlin there to help follow up and make sure that the stuff is done that needs to be done. So let's get over to Caitlin. Tell us a little bit about the cancer screening, the lung cancer screening program at RWJBarnabas.
Yeah, absolutely. So the lung cancer screening program here at Robert Wood, we've been able to drastically increase the amount of screenings we've been doing in the community within the last year. A lot of that is coming out of COVID and patients being more willing to come in for their screenings. But the program, the lung screening, is a test that's typically done once a year. And it is a CAT scan of the chest. We do it right here in our radiology department at the hospital. It is a low dose CAT scan, and it is approved to be done annually. Patients are screened through their either ordering providers or myself for the criteria and eligibility of the screenings. And is it covered by insurance? Patients come into the hospital, they get their screening. Results are usually done within 24 to 48 hours, and the ordering provider will communicate those results with the patients. My role is to monitor and track those patients' results to make sure that they are coming in a timely manner for any follow-up scans or for any visits with pulmonology or thoracic.
So again, you've really revamped this program and really made it very important. You know, prior to COVID, it really wasn't working the way it should. Mm-hmm. COVID came, the whole program was revamped, and now there's many, many more screeners, many more people are being screened.
Yes.
And in the private community, such as myself as a primary care, what should I be looking for in order to send the patient to you for a lung cancer screening?
So the initial qualification would be either a former or current smoker. This test is only for individuals who have a history of smoking. So it would be a current or former smoker. Former smokers had to have quit within the last 15 years. They have to be aged between 50 and 80. Medicare does cover the test up until age 77. Commercial and private insurance covers it up to age 80. The patient would have to be in overall good standing health, not currently going through any current treatments for any other cancers or extensive medical conditions. And the patient would also have to have what's called a pack year history of equal or greater than 20. And pack years are calculated by how many cigarettes are smoked in a day for how many years.
So the important thing is to screen them. Someone who comes to my office who's either a former smoker or current mm-hmm. smoker, has the 30-pack year history, it's screen them.
Yes. So, and the pack year history was actually lowered to 20.
Okay, so 20-pack year history.
Yeah, yep.
Because this way we can find things earlier.
Yes, so early detection is key here, similar to the goal of every screening is early detection. But with lung cancer, like we mentioned before, unfortunately doesn't present symptoms, unfortunately, until it's later stages. So the screenings help us identify and detect anything abnormal in early stages so that we can intervene appropriately.
And at the bottom of the report, I always see it says, make sure the person comes back for an annual screen.
Yes, yes, yep. So the radiologist will give what's called a lung rad score, and that is the radiologist at the end of their exam, they will determine the lung rad score for a patient, and that determines the follow-up protocol for the patient, whether it's 3 months, 6 months, a conventional CT, or a PET scan, or even thoracic visit.
And again, the importance is that you do find sometimes nodules in there that we had no idea that the person had that are not related to cancer, but we follow the Framingham studies and to make a determination when the if they need a lung CAT scan and how frequently is based on the size of the nodules. Sometimes you see a little calcification in the coronary arteries, and therefore it may be worthwhile having the person evaluated by a cardiologist. And,
absolutely.
And so it's not just the lung screening for cancer itself, but it's basically an overall picture of what's going on in the lungs.
Yeah, absolutely. There are incidental findings all of the time on our lung screenings. And when we do have abnormal results, like Dr. Medina said, we meet once a month collectively for our MDCs, and these results are reviewed, and we are making sure that patients are following the appropriate treatment routes, whether that be follow-up imaging or biopsies.
And that the results are then communicated to the person that ordered the scan.
Yeah, so patients receive their results as well as the ordering providers.
And sometimes it's a better idea to send them directly to you, or is it better to go through a pulmonary specialist?
They can go directly through me. So an ordering provider has to sign off on the order, but I'm more than happy to facilitate that process. I can always reach out to our pulmonology team or the patient's primary provider, and we can get the test signed off and ordered for them, and then we initiate the authorization process through their insurance.
So again, a nice, easy screening. Low-dose CT, so the person doesn't have to worry about the radiation exposure. Done as per guidelines. Finding things early which could be treatable and possibly curable.
Absolutely, and the test itself is very easy. The biggest concern I have for patients is any pre-admission testing. There's no blood work, there's no contrast involved, there is no fasting required, any medications can be taken prior to the test. So I know a lot of patients are fearful of the pre-testing, and for this there fortunately is none. It's a very simple test. The actual test itself is only a couple of seconds long.
Again, important to know, no preliminary lab work, no contrast material being given. So it's okay if the person is a diabetic or has any renal disease. The only thing that's going to stop them from doing the lung cancer is they're currently being treated for some other type of malignancy. Correct.
We wouldn't want to expose the patient to any more radiation through further imaging that they're already going through for another type of condition, as well as prolonging their visits here. And we don't want to have a patient that's not in good health, mentally or physically, and add this to their plate. So as long as the patient is in good health and not currently going through any treatments, we're more than willing to get them screened.
So basically we're looking for someone who, if it is positive, is someone who would need or is medically stable enough to sustain treatment for whatever is found.
Yeah, absolutely. We want to make sure, and that's it's what's called a shared decision-making visit. We do these visits prior to the testing, and that is discussed with the provider at those visits, whether a patient is willing to undergo any further imaging, treatment, biopsies, visits, whatever that may entail, if they are willing to even complete that.
Dr. Medina, your thoughts on all of this?
No, I think when it's never good to have lung cancer, but if you're going to have it, it's better to be early stage when there's a chance to cure the disease. And that doesn't necessarily mean it has to be surgery. For people who are not surgical candidates or don't have the physical capacity to withstand a surgery, there are radiation treatment options as well for early stage lung cancers. But the key is to get it while it's small and treatable and curable.
Which is why it is so important that if you're going to do lung cancer screening, it's done at such a facility, such as the Rutgers Cancer Institute, where we do have a team of physicians, social workers, nurses. We have nurse navigators, so that the patient can be treated to the best optimum care.
Agreed.
And again, the fact is that the Rutgers Cancer Institute is the state's only national cancer institute designated as a comprehensive cancer center. So why would you want to go elsewhere?
Agree. And what that means is we also have a full roster of clinical trials. There are many options for patients to explore through our institution, the full spectrum of specialists, all of the technologies that have transformed my field and our industry, and the clinical trials aspect as well.
Again, the best physicians, board certified, fellows in whatever medical academy they're in, nurses who are experts on what they are doing, social workers who know and are able to help people, oncologists, pulmonary physicians. It's a gambit of physicians who get together as a team. And I'm sorry, not only the physicians, but also the social workers and everyone else who's part of the team, in order to treat the patient the best way possible and as close to their home as possible.
And that's really the most important thing is people should not have to travel hours for the highest level of care. We're fortunate to be able to offer this right in the middle of the state.
So what other additional resources are available to lung cancer patients through the RWJBarnabas Health in collaboration with the Rutgers Cancer Institute?
I think, like you mentioned earlier, the QUIT program that we have for current smokers, that is with the Robert Wood Johnson Institute for Prevention and Recovery. They offer an amazing 8-week program for patients who are currently smoking. It's a cessation program. It can be done in person and virtually. They also offer tobacco nicotine replacement therapies for free that are sent to patients' house. And that includes a combination of inhalers, nicotine patches, any gums, any type of replacement therapy that'll work best for the patient. And that's all done, like I said, either virtually or in person. And all of the replacement therapies are sent directly to the patient complimentary.
Actually, it's a terrific program. I've sent many patients there. The people who run it are excellent, and the patients do definitely have choices on how they can stop smoking. They do use the patches, the gums, the lozenges. They do oral medications if necessary. There are even some people around who basically it's meditation that they need to help to get off of it. It's actually quite a good program. So if the person does go through the lung screening through RWJBarnabas Health and is actually someone who smokes, it's another good resource to send them to.
Absolutely. Again, it's always up to the patient to quit smoking. With any addiction, it's the patient has to be willing to put in the work. But the Institute for Prevention and Recovery is an amazing team. And they're very willing to work with individuals to customize a tailored program that works best for them.
And then at the Cancer Institute, the tailored program of treatment, whether it involves chemotherapy, radiation, thoracic surgery. And again, we have Dr. Medina here, who's an excellent thoracic surgeon, who's a surgical oncologist also. So you've got someone who's really knows his stuff taking care of you.
Absolutely. Along with all of our amazing physicians in our comprehensive approach team here. Like you mentioned before, we have an amazing group of social workers and navigators, and that's really the key part too. when undergoing cancer treatment. This is something that's very new, very confusing. You need some navigation and assistance, and we offer a great team approach with that as well, side by side with the physicians.
Yes, they actually are very important because they are usually the people who are first contacted by the patient. And after the patient's had a visit, and once they hear the word cancer, they don't hear anything else after the word cancer. They don't know what the next steps are. That nurse navigator follow-up really makes the difference.
Absolutely. Everyone needs some guidance in this trying time of their life. Like you said, once you hear cancer, you kind of blank out and that's it. So it's good to have someone on your side that's navigating you through your appointments and even assisting you with any social services. We do offer Uber Health, so we have transportation for patients that are in need. They offer any assistance with any social determinants or any barriers to patients' care.
So, Caitlin, tell us, before we conclude the program, any key messages the audience should know about the lung cancer services at RWJBarnabas Health and at the Rutgers Cancer Institute of New Jersey?
Yeah, I said it last year, and I'll say it again. Early detection is key. That is the biggest message that I can spread today. It is all about early detection and letting us intervene in an appropriate manner before it's too late. Dr.
Medina, any thoughts from you?
I agree. It's so important. If you're eligible for lung cancer screening, please get your scans. This is our chance to make an intervention and potentially cure a disease before it becomes out of control.
So again, if you are 40 years old to 80 years old and you're listening to this program on the TV right now, and you either used to smoke and stopped smoking within the last 15 years, or you are now continuously smoking, please get in touch with a physician or get in touch with the RWJBarnabas Health Lung Cancer Screening program. Make an appointment. Call up Caitlin. Let her make an appointment to get the screening done. Get it done. It's the same thing as getting your cholesterol taken care of. It's the same thing as getting an EKG taken care of. Do it. It's so important for your health, and it's so important for you to know what your future is. And then once something happens, if something unfortunately happens, make sure you are invested and get into the Rutgers Cancer Institute. It is a comprehensive cancer center. It's close by. It has the nurse navigators. It has the excellent physicians. It has the excellent social services. It's where you want to be treated, and it's where hopefully you'll be cured.
Absolutely.
So any last thoughts from either of the two of you?
I hope that I start getting more calls from the community. We are definitely missing a huge population of people. And I know a lot of that comes from fear. It's definitely something, patients are fearful of getting screened. But again, we have a whole comprehensive team here for you to assist you with start to finish. And we're here for you every step of the way.
Thank you so much. Thank you both for being here. And thank you for everything you do for RWJBarnabas Health. Thank you for everything you do for our patients and for helpful in reduction of lung cancer.
Thank you.
Thanks for having us.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 844-CANCERNJ. For more information about lung cancer services at RWJBarnabas Health, please visit us at www.rwjbh.org/cancer.